Hi, Fibro Warrior. I hope you're having a great day. I finished my smoothie, and so now it's time to learn about some really interesting information. As a fellow fibromyalgia warrior, I'd love hearing from you. In this video, one of you asked me about SOT, SOT. Have you heard about supportive oligonucleotide therapy, better known as SOT? Some clinics claim it can help with chronic infections and even fibromyalgia. But is that true? Today we'll break down what SOT is, how it works, and whether it's a real option for fibromyalgia patients. Here we go. Hello, friends. I'm Dr. Pammy Jean, psychologist and fellow fibromyalgia warrior. Today, we'll explore research-backed strategies to calm our body, heal our mind, and find hope again. This video is for educational purposes only. Always talk to a qualified healthcare professional before starting any treatment. So what is SOT? Supportive oligonucleotide therapy is an experimental treatment using modified short RNA molecules called oligonucleotides to target and reduce specific disease-causing agents such as bacteria, viruses, or cancer cells. And when they say short, it means 20 different nucleotides, so it's a really big molecule. Here's how it works. These oligonucleotides bind to the pathogen's genetic material. The therapy is designed based on a patient's specific disease markers. The oligonucleotides are introduced into the body to stop the production of proteins or genetic material from the target cells. Preliminary studies have explored its use for certain viral infections like Lyme disease and as a complementary treatment for cancer. It blocks replication and weakens the pathogen. Our immune system then clears it out. The effect can last for 4 to 6 months after a single infusion. Okay, so here's what we know. The oligonucleotide binds to the pathogen's genetic material, the DNA or RNA, and prevents it from replicating. This stops the pathogen from multiplying and spreading, so you don't become sicker and sicker. As a result, the pathogen becomes weakened and cannot sustain infection. So what gets cleared out? It's the pathogen itself, the virus, bacterium, or other microorganism that was causing the infection. Your immune system recognizes the weakened pathogen and eliminates it through normal immune processes like phagocytosis and antibody-mediated destruction. But the status is that it's still considered an experimental or preliminary therapy. So the therapy doesn't directly kill the pathogen, it disables its ability to replicate. And then your immune system clears the actual pathogen particles and infected cells. That's pretty cool. SOT is mostly used in specialized clinics for chronic infections such as Lyme disease, Babesia, Bartonella, Ehrlichia, and viral infections like Epstein-Barr and herpes viruses. It also is being studied for certain cancers. But here's the catch, it's still experimental for all of these diseases and not FDA approved for their use. I mean, some of us use not FDA approved medications specifically for fibro, but we still take them because they work. And for reference, gabapentin is what I take, and it's not FDA approved specifically for fibromyalgia. Some of you may take amitriptyline or LDN, low dose naltrexone. So trust your doctor or get a second opinion. And for clarification, Lyme disease is not a genetic disease. It's an infectious disease caused by the bacterium Borrelia burgdorferi, which is transmitted to humans through the bite of infected black-legged ticks. We have those around here. Deer ticks. Some genetic factors may influence susceptibility and immune response, meaning certain people might be more prone to severe symptoms or persistent infection, but this doesn't make Lyme disease a genetic disorder. It's essentially the same principle for those other infections I mentioned. So this is all new to me, and so I was confused about whether oligonucleotide therapy was the same as gene therapy. I mean, do I want my genetics modified? Well, if I thought it could help me, I probably would do it. But here's the breakdown. Gene therapy, against the pathogen, the definition is a broad category of treatments that aim to modify or replace defective genes to treat or prevent disease. The mechanism usually involves delivering a functional copy of a gene or editing the existing gene into cells using vectors like viruses. And the goal is to correct the underlying genetic defect by adding, replacing, or editing entire genes. But supportive oligonucleotide therapy, the definition is a more targeted approach using short synthetic strands of nucleotides, DNA or RNA, to modify gene expression or correct mutations. Is fibro a genetic mutation? I'll talk about that more in a minute. But the mechanism for SOT is that these oligonucleotides can bind to RNA to alter splicing, like antisense oligonucleotides, and to silence genes, as in RNA interference, to correct single base mutations via base editing or repair mechanisms. That's a lot of words, but the goal is to influence how a gene is expressed or how its RNA is processed without necessarily adding a whole new gene. So that sounds good. So the key differences are that gene therapy is a whole gene replacement or editing, where oligonucleotide therapy is small sequence-based intervention, often at the RNA level. They both fall under the umbrella of genetic medicine, but oligonucleotide therapy is generally considered a subset of molecular therapies, not full gene therapy. And then there are other SOTs that I thought would be interesting to show, as you can see in this. So is fibro a genetic mutation? Well, what we know so far is that there are 26 or so genetic loci linked to fibro, mostly related to pain processing and nervous system function, and that fibromyalgia is considered polygenic, meaning many genes with small effects that contribute to the risk, along with environmental factors like stress, infections, or trauma. So, some of us can say that an infection had a direct impact on getting fibro. I believe it did play a role in why I got fibromyalgia, but it's not the only reason. What about you? So we know that fibromyalgia is not a monogenic disorder. I'm sorry about my gravelly voice. It's a constant battle for me with GERD. And if I'm not drinking enough water and get dehydrated, or I don't know, this morning I woke up with a sore throat. So please forgive me. So we know that fibromyalgia is not a monogenic disorder, unlike conditions caused by a single mutation, as in cystic fibrosis. Fibromyalgia involves complex interactions between genes and other factors. It's better described as a genetic predisposition. We've heard that before, right? Not a direct mutation-driven disease. There's a familial risk. Fibromyalgia tends to run in families. First-degree relatives of someone with fibromyalgia are significantly more likely to develop it, suggesting a hereditary component. Does fibro run in your family? I have an older brother and a cousin who both say that they have fibromyalgia. So there are genetic variants. Large genome-wide association studies have identified multiple genetic variants, not one single mutation associated with fibromyalgia risk. The process starts with the blood test to identify the pathogen. Then a custom oligonucleotide is created and infused intravenously. The potential benefits targets pathogens at the genetic level. It may help with infections that are resistant to antibiotics. Remember when we were told that antibiotics were the cure-all? And now we know that too much can have a definite negative effect, especially in our bowels. But this procedure could improve symptoms and overall health of the infection. But remember, results vary and research is limited at this time. There are risks and limitations, like with all treatments. The side effects can include fatigue, headaches, and muscle aches. There's little long-term safety data because it's new, it's expensive, often thousands of dollars, and usually not covered by insurance. And again, it's still considered investigational. Most insurance plans don't cover experimental treatments, meaning patients typically pay out of pocket. FDA-approved antisense drugs can cost hundreds of thousands per year, while SOT for infections often costs $2,000 to $5,000 per infusion and may require multiple rounds. Even for approved drugs, insurers often require prior authorization and documentation of medical necessity. So the bottom line, FDA-approved antisense oligonucleotides drugs for genetic diseases, often covered by insurance with strict criteria, but SOT for infections like Lyme, EBV, etc., is almost never covered and considered experimental. Is this something you are seeking? Are you considering this? Have you checked with your insurance? Have you checked with your doctor? I'm just curious. I mean, I'm going by the information I'm finding on the internet. So, what are you finding in real life? That's what I'd love to hear. So, the bottom line, what most of us are here for is to find out if SOT is suitable for fibromyalgia. The short answer, no direct evidence supports this. Fibromyalgia isn't caused by a single pathogen. It's a complex condition involving nervous system pain processing and central sensitization. While infections like EBV or Lyme may trigger symptoms in some people with fibromyalgia, fibromyalgia itself is not an infectious disease. So SOT might only help if you have a documented chronic infection contributing to your symptoms, not for fibromyalgia itself or fibromyalgia alone. Fibromyalgia is not caused by a single pathogen or gene mutation. Does that mean I don't recommend it? I'm not going to tell you what is important to you. If you feel that this is something you would like to explore, by all means, explore it. But always talk to your doctor and understand all of the risks. I mean, we have evidence-based fibromyalgia care, right? We have medications like duloxetine, pregabalin, milnacipran, and we know that lifestyle changes help with things like gentle exercise, having a good sleep routine, practicing stress management, or therapies like CBT or physical therapy, and eating an anti-inflammatory diet. These things have strong clinical support. Here's a quick comparison. So, while SOT is promising for chronic infections, it's not a proven treatment for fibromyalgia. If you're considering it, talk to your doctor and weigh the risk. Maybe it will decrease your symptoms, but it most likely will not reverse them. If you find this information helpful, please hit that subscribe button and like the video. I mean, it really makes a difference. And share this video with someone who you think might be interested in this topic. Maybe they need clarity on fibromyalgia treatments. So I'll see you next time. I send you gentle hugs and support. Love you. Fibromyalgia in some people